So I think we can start. Welcome everybody. My name is Ahmed Farag, a pediatric oncologist originally from Egypt, working in Switzerland in Lucerne. I am a co-chair of the pediatric traditional and complementary medicine within the Global Health Network of the International Society of Pediatric Oncology. I want to welcome everybody here, and I want to welcome our co-chair also, Dr. Roberto Campos Geldres. He is a pediatric hematologist oncologist in Las Higueras Hospital and the head of pediatric oncology unit in Sanatorio Alemán Clinic. He is an assistant professor at University of Concepcion and the founder of the first pediatric integrative oncology unit in Chile. He has a certification in integrative pediatrics from the American Academy of Integrative Pediatrics. And we are very eager to hear from you about the traditional and complementary medicine in Chile. You can start.
Thank you. I will show my screen. Can you see it? It's working.
Yes.
Yes, okay. Well, thank you all for all the presentation and this invitation today to talk about Pediatric Integrative Oncology in Chile. I'm Roberto Campos. I'm from the south of Chile. And for me, it's really a pleasure to be here and talk about this really interesting topic that it's really new for us, like in Latin America. Well, here all my work and already he say it, but I'm a hematologist and oncologist pediatrician, and I have a certification from Academy of Pediatric Integrative Medicine. And recently, I have been elected for the co-chair of this group. First, we have to do our definition of what is integrative medicine. It's good to be really clear about how we do this relationship between conventional and integrative oncology. We always go to the patients and their family with the whole system. We include mind and body practice, natural products, and lifestyle modifications. And we can go along all the journey of the cancer from the beginning, even with the patients with active treatment, palliative care of end of life, we can use it. And why is it so important to talk about this? Because the patients are using integrative treatment. You see here in this slide, comes from 12% in Italy and go up to 85% in Southwest Asia. And it's really nice to talk about this because we have to be really well coordinated between the oncology, conventional oncology, and integrative oncology to treat physical and emotional symptoms. And in summary, it's a partnership between the patient's family oncology team that get conventional and integrative treatment, environment factors, emotional and spiritual factors, and the role of other healing systems. What about integrative medicine in the world? If you see in this slide, we have many publications or data that coming from all around the world, but even we use it for survivorship patients that comes to from 52 to 58%, and we also use it for palliative care coming from 29 in Canada, go up 43% in Germany or 63% in Hong Kong. This is like a slide from around the world, but what happened with Latin America? Well, we didn't have any data at all. We just have few studies, and in the whole integrative medicine, we just contribute with the 6% of the whole publications. That is really low. We have to work in that. And the main country that is working on this is Brazil. They have been made a really good integrative unit from 2018 because they did a collaboration with a German hospital on 2015. The prevalence of using integrative medicine is coming from 4% to 41%, and they are working really well. We are trying to establish a new networking of integrative medicine from all South America or Latin America to get this very good collaboration. But what about Chile? Well, if you don't know Chile, we are here. This is our country. We are the longest country around the world, and we have 5 units actually in Chile. 4 of them are in the capital of Chile, it's Santiago, and the one I belong is from the south of Chile, in a city called Concepcion. We have been working together to see what are the professionals are associated with integrative medicine in pediatric patients. If you see here, we got almost 60% of medical doctors, 27% of nurse, and 9% of physical therapists. In all the centers, we asked them how they were using this integrative medicine and who was made it. A few data from cancer in Chile. We have 500 cases per year, and our patients, the 43% come through to 1 to 4 years old, and 82% of the patients go to public health insurance, and the main diagnosis is leukemia, going up to 40%. What about integrative medicine in Chile? Well, our law of alternative medical practice is really old. It's coming from the 2006 and start with acupuncture, then 2009 go to homeopathy, and 2012 include naturopathy. These are the 3 are all regulated, and when they did a study to asking what the patients that were using it, 76% were not regulated sources or therapies. The first one therapy that we are using in Chile is acupuncture for mental health diagnosis, and only we have the 11% of the professionals were medical doctors. But a good news that on 2023, we got a cancer law that includes integrative oncology in all the centers, including pediatric centers, and we are working to get all this network, and I will show you what we have been doing. So what we know about using pediatric integrative medicine in Chile, we didn't have any data, so we created. And it's really interesting that I will show you this study that we did to get the prevalence and patients characteristic of using integrative medicine. You see here, 40% of the patients were using religion, 27% of the patients were using supplements. And this is really, we have to highlight, because if the patients have a diagnosis of a brain tumor, increase the chance of using complementary medicine by 20%. So this is our first red flag to see if the patient have a brain tumor, he will be maybe able to use integrative oncology. We asked them how they use, if they use integrative medicine, 51% did use it. And if they communicated, 53% communicated. So if we see here, half of the patients that were using it have not, and half of the patients were communicate, and half of the patients didn't communicate with the oncology team. And we asked them, how did your oncologists react? A good response, 58%, and that response, almost 50%. 27% he listened and disagreed, and 24% the oncologist got angry. So it was a really important issue for us because maybe from all the oncologists, they didn't know what was integrative oncology, and we have to change that. I would like to highlight this because where did the patients get the information? What were their sources? 60% coming from a friend or family, 30% coming from internet. So if we get all together, 90% of the informations are coming from a not regulated source. So the patients are using it, they are not telling the oncology team they're using it, and they take all the information for a not regulated source. So we have to do something with this. Recently, the health department of our government, they did this technical guidance to get complementary medicine and wellness practice health for primary care. So this big step for us, like coming from the health department. What is our Chilean experience about integrative oncology? We have, I told you before in the last slides, that we have 5 centers. 4 of them are in the capital of Chile, and I will show you what they have been doing, and then I will show my experience in the one is in the south of Chile. The first one is Hospital Luis Calvo Maquena, and they have been working really well since 2016, and they have worked very, very good in a pediatric grief, and they go flower therapy, pediatric trina, and expressive art. They have been working really well with the grief and how they process this with emotionals and feeling and the art. The next one is Hospital Roberto del Rio, also in Santiago. They start the unit in 2021, and they have working on bud flowers, acupunctures for parents and team, art therapy, music therapy, and recently they got osteopathy. Hospital Sotero del Rio, they have been working in a really long way with expressive art, like clown and music therapy. This is really a pioneer on the clown therapy, and they have been showing all the centers how we have to do it. They also do bud flower, acupuncture for patients and the oncology team, and art therapy. And the last one coming from the capital is an hospice. It's called Casa de Luz, and they have been working from 2022. It's a private institution, and they have been working like you see here in the pictures, animal therapy, there's a horse therapy, and here are the dog therapy. They have been working yoga therapy, art therapy, and music therapy. It's all going to palliative care and end of life with the patients and their family. They live there. What about our integrative unit? Well, I belong to the Sanatorio Alemán. It's in the south of Chile. First, we start like a collaboration with a Barcelona Children's Hospital on 2020. And the 2021, we became the first private integrative unit in the south of Chile. And there was really good alliance with the Barcelona Hospital. Again, this is the Chilean map, and the capital of Chile is here, and we are like 500 kilometers far away from Santiago, the capital, and our patients come from a private health insurance. This is a short video. I will show you that what we are doing in our center and how we work all the team together. It's in Spanish, but it's with English subtitles so you can understand.
programa de oncología integrativa de salud mental incorpora elementos para ayudar a la seguridad y el bienestar de cada uno de los pacientes. El principal es el secundario a través de un plan de desarrollo creado real y estabilidad, dar 4 elementos que son la terapia siempre acompañado de la oncología tradicional.
So as a short video that show our experience and how we have been working on this. And this will be really fast, how we build this bridge or pathway between conventional and integrative. But first, we did a first diagnosis, like I show you with our study, that the patients that were using it but was not regulated. Then we define our local goals, and we went to the next step that it was the implementation. Get all the areas that we are going to work. Third one, we get more training and certification, and our friends from Barcelona, they help a lot to us. And I did the certification from the Academy of Pediatric Integrative Medicine. But what is next? What is our next step? To get evaluation that all we are doing is working and objective, and education to show what is integrative oncology for patients, for family, and also for medical students. What is our goal? Is to increase well-being and quality of life of the patients, reduce secondary symptoms of the disease, treatment toxicity, and pain drugs going down. These were some of the implementations area. We did an implementation for a parents room. These are some classes to the nurse of our unit. We have a little library and how we have been working together like a team. All the training and certifications. Here's Dr. Esther Martinez. She's the chief or head the Integrative Oncology of Barcelona Children's Hospital, and she was really nice with us to implement our unit and all the certifications and course that we have been to it from all these years since 2021. Here are some education. We have talking about this in palliative care and using integrative medicine in St. Jude. Here are some for medical students. We have been working with the Society of Chilean Pediatric. We did also a collaboration with the Stanford Medicine Children with their integrative unit, pediatricians. And we had doing some courses for the Society of Chilean Pediatric Patients, also with 2 courses about this. And recently, last year in December, we were invited to the International Congress of Integrative Medicine, and they have a track of Pediatric Integrative Oncology. So it was really good to talk about this. But what is our work plan with the patients? I will show you what is our experience and how we have been working. Our main goal is to improve patient healthcare, improving quality of life based on patient needs, physical or emotional or both, based evidence, and always safety. We make a work plan for this patient and their family for healing or welfare or both. The treatment of the symptoms that we start working, it was vomiting and nausea, sleep disorders, and pain relief. And now I will show all the therapies that we have been working since 2021 and how the patients react about this. We have been 182 interventions. The main symptoms that we have been treating was anxiety, and we have almost 5 sessions per patient in each therapy. Our patients in integrative oncology comes from 4 to 15 years with average age of 8 years old. The first one is yoga therapy. Here is Maciel, our nurse. She is doing yoga sessions inpatient and outpatients, and she take like almost 2 or 3 times a week with each patient. They have been working on pain and fatigue, and the results are really, really good. The patients have fun, they enjoy it, and they get better going down with the pain drugs. The second one is aromatherapy. Here's Anna Karen. She's our aromatherapist. And we have been working with a started kit, like you see here, it's in Spanish, but it's a aromatherapy kit with the patients is diagnosed with a cancer in our unit. They get this aromatherapy kit. It's one for nausea and vomiting, one for pain, another one for sleep disorder. So they can have it from the beginning and they can use it as needed. Like nausea and vomiting, sleep disorder, we always go to topical and inhaler, all this aroma. Integrative nutrition. It was really nice to talk about this. Here is Pia, our dietitian, because she includes supplements and food choices. They go with her once a week in the inpatient or outpatient. She treats nausea and vomiting. The type of diet that we have been working is Mediterranean or anti-inflammatory and go up with the supplements. Acupuncture. Here's Alvaro. He is our physical therapist. And I think it was the most scary therapy that we did have for the patients and their family. But after they use it, they want to use it. They want to use it again. It was really, really good results. They can go once a week or maybe 2 or 3 times a week. And they go for nausea, vomiting, sleep disorder, and pain. It really works for us for pain patients and how they can resolve and going down with the pain drugs. The most I like it is this one. It's called nature-based intervention. Well, you will say, what is this? Well, we go outside with the patients and their family. We do meditation, we do movement, we get nature connection, and it's fun. They can talk each other about their feelings, their emotional, and they are moving. If they are moving, they're getting better on pain and fatigue, and also we get better on mental health. Dog therapy. We did this with a non-profit foundation. They can go once a month, and the especially symptoms that they treat or we treat, it was relaxation, calming, and well-being for pain procedures. The results were really good on these patients, like the little one and the big ones. Music therapy. Here's Eileen. She's our speech therapist. She comes 2 or 3 times a week. They have a lot of fun, like you see here. All the patients are smiling because they have using music instruments. They sing songs. They have a lot of fun. They dance. It's really interesting how they have been working, and also they can express themselves and their emotions. Art therapy. Here's Hannelore. She's our art therapist, and it was really a good impact of this session on our teenagers because the patient didn't want to talk, but they want to try, or they can do like a sculpture. She comes 2 or 3 times a week, and they can go relaxation, calming, well-being. Even the parents, like you see here in this picture, they're using this session to get always better on this. And she worked also with our psychologists to talk about emotions, about feelings, and how they can deal with this on the journey of the cancer. Book club or library. Maybe it's common for you on your countries, but for us, it's not usual to have like a library inside of a hospital. So we create this in a type of intervention of reading. We got a little books for all ages, from 1 to old patients, and they have been working on feelings, emotions, and only can go out of the room. They can go there, they can walk, they can have fun, they can paint. It was really good interventions. But what is next? I, we would love to, like a team, to get this evaluation in a quality of life, how the patients will react to these interventions, and what is the impact, objective impact that we are doing with all these interventions. We are working with a non-profit foundation. It's called Comfort Kids. They will give us mind body toys and playful, and we can work with them from the beginning. They have like a stress ball, they can have bubbles, and how we can deal with all the stressful or all the feelings from the beginning. It's like a safe box that they will have there with all these toys and instruments to use it when they need it. But the most important of all this is our team. You see here on these pictures, we have the Integrative Oncology team, and here is our team, conventional and integrative. We work together. We are the same people, we are the same one sometimes, and how this is the really good, because we communicate, we work together. We are not a competition. We are partners, we are friends of getting better, healing our patients and their family. Finally, I will finish with this quote from Maya Angelou. It has said, I have learned that the people will forget what you said, the people will forget what you did, but the people will never forget how you made them feel. And it's really interesting to talk about this, because when we do like bad news or a recent diagnosis of cancer, the people forget about everything, but they don't forget how we go with them with compassion, with company, and we get with them like a family. And don't forget also that the communication is also a treatment, and we have to talk with our patients and their family, and this is what integrative oncology brings to us. Here are my social media and my email, and thanks for your attention. I'm open to answer any question that you have.
Thank you, Roberto, very much. It was really fantastic and very interesting. We can open the discussion. Personally, I have some questions at first. You have said that within the 5 centers in Chile, all of them are having integrative medicine centers. And I think it also includes all of the teams who are working in these centers are very well educated also and have a good experience in this integrative medicine. Because of that, my question is, you have said that about 50% of your patients do not disclose the use of T&CM. What's the cause? What do you think?
Well, sometimes like for our culture, they are afraid to talk with the oncologist about this, because they will react like maybe they will get mad, like I show you on our study. And sometimes they say that we have to choose like an alternative treatment or like conventional treatment, that we can work together. That's like the difference that when we talk with them, like say, okay, we can work together, and this is like a complementary treatment. you don't have to go out with the conventional treatment, chemo, surgery, radiation. You have to go together. That's why the first time they were scared about it.
And practically, did you notice in your patients that some of them are coming very late in late stages because they have lost a lot of time, for example, just in using traditional medicine, or you don't have this problem? Or also, do you have some patients who have abandoned therapy just to use traditional medicine outside your center? Or
Yeah,
you
we
don't
have
expect?
that. Yeah, we have that issues because we have traditional medicine also in Chile, but there are really few patients. I think less than 5% of the patients will have of this. Yeah, the conventional medicine or integrative oncology conventional, they go like very well with that in Chile. So maybe 95% of our patients in Chile are working with the conventional one.
Okay. And did you do any assessment from the patients to hear from them if they are happy with these integrative centers or not, if they think that these centers have added already to the complementary or to the conventional therapy or not? I mean, their opinion. Did you make any assessment for that?
No, we are trying to work on that, like how they react to all this intervention, but we have been noticed that the patients are more open to talk about integrative treatment. Like we can talk and they can say, I'm taking this supplement, I'm taking these herbs, and we can discuss and we can give them all the information together that don't get worse with the chemotherapy or compete with other drugs. Yeah.
Okay, and maybe my last question also. You have noticed a lot of types which are used within your center. You have mentioned two things. May you clarify what are these things exactly? The pediatric twina and the art therapy. What are they?
The pediatric twina is a massage therapy that they can use it like it's a strong massage therapy. They can go with oils and they do that. And the other one was I didn't hear it.
Art therapy.
The art therapy, it's like the expression arts, like they can go
No, not art, but AR therapy. May I have wrongly heard that?
I don't know. I
Okay, it
didn't
was written
understand.
as art therapy. It's okay, no problem. But
Yeah, it's okay.
do you have a special type of traditional medicine which is used in Chile because it's in a little bit isolated area from the world, far away from us? You know, every country or every region in the world have its special traditional medicine. For example, here in Central Europe, the homeotherapy. In the Arabian countries, there a lot of people are using the urine of camels, for example. Do you have special thing like that in Chile?
No, we don't. We don't have like traditional medicines like working in our health system right now. But
It's good.
yeah.
Okay, we open also the discussion for all of the other attendees.
I think they have like a few questions
in
on
the
the
chat.
chat.
Yes, in the chat, Maria Guto asked about, she said, thank you for your great presentation. Could a child after bone marrow transplant or with neutropenia play with the dog?
Yeah, that's really good question. Like always we go with the safe, even with acupuncture or with dog therapy, always go with the not neutropenia, no plaquetopenia. The patients have to be safe to use this. Some protocols about dog therapy, they have really good like information that they were clean, they don't have infections, like they can do it. But for us, we do it with non-neutropenia.
Okay. There is another question also from Marina Mati. She's asking, did you find any barrier from the medical team to use integrative medicine on in the Department of Pediatric Oncology?
Yes, it was like really hard at the beginning because our partners, colleagues, they were like very acceptive about integrative oncology. They were thinking like we are going to replace a treatment and we're not working like together. But since 2021, we have been working with them, and the patients that were talking about this and they were feeling better, and they would say, we need more acupuncture, we need more yoga, and they say, okay, I think it's working, and the patients are feeling well, and we are not getting competition with the chemo or other treatment. But it was like, at the beginning, it was really hard, yeah.
Any other one have any question? Okay, may I use also the chance to encourage everyone to be a member of the International Society of Pediatric Oncology. He or she will receive a lot of benefits from this membership to attend our educational meetings and to attend also the SIPE conference with a reduced registration fees. We invite all of you also, of course, to attend the next SIPE Congress, which will be in Amsterdam next October. And to attend our next meeting of the Traditional and Complementary Medicine Working Group. It will be in May, and it will be about the use of traditional and complementary medicine from Central Europe, especially in Germany and Switzerland. So I'm still waiting if any other one have any question. Okay, Roberto, thank you so much. It was really fantastic and informative for all of us. Thank you so much. Thank you, everybody.
Thanks. Have a good day.
You too. Bye-bye.
Bye.